more insight, I spoke with Dr. Tihitena Negussie Mammo, Global Clinical Director at Lifebox and the clinical lead for the Smile Train Lifebox Safe Surgery and Anesthesia initiative. Take a look.
Children are not small adults, so they need special type of care and management. So people specialized in that area should be there to avail the necessary service for these kids. Unfortunately, there is significant gap both in surgical field and anesthesia field for serving the kids. Some of the resources which are made for adults are not fit enough for children to be cared, including monitoring devices, treatment fluids, or others. So those things results in significant compromisation in the care of kids.
Smile Train has announced the Safe Surgery and Anesthesia initiative in partnership with Lifebox, aiming to make surgery safer in low-resource setting. Tell us more about the initiative. What does it look like?
Basically working on addressing the gaps on tools as well as human resource capacities. So the tools and the capacities will be helpful in filling the gap by availing the devices in the needy sites and also delivering trainings whenever the need arises. One of the important tools which should not be missed in surgical patient care was pulse oximetry.
Talk to us about implementing this project. What countries will participate? Where will you be deploying this resource?
In the next 3 years, the plan of the initiative is at least to distribute this co-branded pulse oximetry in at least 20 countries. Around 11,000 pulse oximetries are planned to be distributed and started to be distributed right now. Some of the countries are Kenya, Rwanda, Somaliland, Senegal, Madagascar, El Salvador, Ecuador, Laos, so representing Africa, South America, as well as Asia. We are trying to address all pediatric surgical patients. Some specific emphasis might be given for cleft palate and cleft lip patients, but all pediatric surgery patients will be addressed by the benefit of this initiative.
You mentioned the cleft lip palate. How much of a problem is it?
It is one of the commonest congenital anomaly. Fortunately, it is visible to diagnose unless it is isolated cleft palate. The care might be difficult to get on time because of some taboo or social issues in the area, but it is easily diagnosed by parents, the community health workers, as well as the medical professionals. It is common, just like the cardiac anomalies and others worldwide.
What is the status now in terms of acceptance, understanding of this condition, and also treatment for the condition on the continent?
Definitely cleft palate and lip surgery, one of the surgery which needs good anesthesia care and dedicated surgical care, because it is the area where both surgeons and anesthesia are working in the mouth area. So it is one of the challenging areas. Starting from the Smile Train's work worldwide, it has to be addressed by creating awareness, collaborating with surgeons on those fields so that they can identify the patient and avail the services. Compared to like 10 or 11 years back, now there's service getting by these individuals or patients, and there is a good outcome on the operated patients.
What will be considered a safe surgery?
Safe surgery means preventing preventable causes of complications after surgery. Surgery is not a thing without complications, but if you address human error as well as system error, 50% of the complication can be easily avoided. So that's why I'm stressing on safer practices.
As the clinical lead of the initiative, what will a successful project look like for you?
I want to make sure that every service is delivered for the patients should be in a safe and quality way. In order to address that, we will try to look for colleagues who will identify the gaps there. So if it is training, we will avail training. If it is tool, we will try to distribute the tools as much as possible. So those are the ways we are addressing the problem.